Hello, welcome to Drugs Unwrapped. I'm Rob, and today I am joined by Jamie. Jamie, how are we?
I'm good. How are you?
Yeah, good, thank you. So today's episode is a little bit off the cuff. So it's just a short one in reaction to the drug-related deaths that were published last week. So we are recording as of the Monday, and they were published on Friday, the 17th of October. So just very quickly, Jamie, just to run through the main headlines, I guess. So the data is for England and Wales. So across the two nations, it was the highest on record again for the 12th year running. So the actual figure published was 5,565 fatalities. And then to bring that to Wales in terms of drugs, so these are for drug poisoning. For Wales, it was 417, so that too was the highest figure since records began and is the highest figure for the second year running. I guess your initial kind of thoughts around that data?
I suppose this is a clear and kind of sombering summary of the most recent ONS data on the drug misuse deaths. And it highlights several, I think, key themes that we've been discussing over the last podcasts collectively, I suppose. And the concerns are worth unpacking, I suppose, in what we're about to have a look at now in regards to what the analytics say and what actually translates into then what people are receiving as in services and what the substances that they're using and what the issues and challenges are there.
Obviously, the main players in terms of the actual fatalities, obviously opiates are number one. They account for just under 50% of all fatalities. And obviously cocaine is a big mover once again. So cocaine fatalities in Wales. So we'll just stick to Wales rather than England and Wales. I know I started with the two nations at the top. But yeah, for cocaine in Wales, it increased by 21%. And that actually equates now in the last 10, 11 years, over 1,000% increase in the amount of cocaine-related fatalities. Does that kind of reflect in terms of from service provision what we see?
I think obviously from an analytical take, I think as we were just saying, with the continuing upward trend that we're seeing in drug-related deaths, one of the major factors is that drug deaths are continuing to rise despite long-term attempts in raising awareness of overdose. The investment that we've seen then from Welsh Government and other pots of funds that we can access as third sector or NGOs, and national strategies, which potentially are not currently present, which I think then all together suggest systemic issues in regards to that. And like you're saying, with the significant increase in cocaine deaths, what we're seeing is persistent inequalities in access to effective treatment and recovery support, which is representative of what people are coming into services requesting support for. And also, what are we doing about hitting those individuals that are unaware of what support is available to them early doors? Is that message of harm reduction hitting as many people as we can? And what is the best means to do that? Is it via this kind of form of medium? Or is it, getting, boots on the street and finding those individuals? There's so many, I think, gaps where we are missing, but also there are other areas where we're doing really well, and we, those are our strengths. But that's probably just one element of, I think, some of the issues that we're seeing.
I think it'd be more interesting because obviously this data comes from the Office of National Statistics. And I think we only get a snapshot really in terms of what's actually going on from those figures. And that, I think we also have to sometimes take the figures to a degree based on a statistical format with a pinch of salt. Because some of the figures that would have been included in the 2024 data actually occurred before that.
It's crude, isn't it? It's really crude data that we're working with.
And some of the fatalities that occurred in 2024 won't have been accounted for yet. And obviously there was a report going back a month or so ago that thousands of opiate-related deaths, 2,500 cocaine-related deaths have been missed off the national, kind of the official data as well. So, but yeah, in terms of in Wales, we have a Public Health Wales report that comes later in the year. It'll be interesting, comes from that, because I think it provides you with some mitigating factors that come from that. So like the most interesting for me is like how many people are known to services or have been engaged with services in the last 12 months. And especially when you're looking at like opiate related deaths and stuff like that, how many times has naloxone been used? And I always find it quite interesting when naloxone's been used in fatal episodes, you know, and actually what's happened there, you know, is it that
data is kind of challenging to get sometimes, isn't it? Unless someone is like really engaged with their service or with their needle syringe program where that data can be collected. And sometimes there are other services that are working really well with people who do experience and do manage and deal with opiate related overdoses. But then where does that information go to and how does it get captured? If you're working within like the homelessness sector or something like that. So with us, we know what we do with that, but we don't necessarily always get the information.
So why the rise? I know you've alluded to some of the things, but is there anything else that you think could kind of capture some of the main reasons as to why we're essentially seeing an increase in drug-related deaths? Obviously, as I said, in Wales, it's for the last 2 years now. England, Wales has been, you know, for the last 12 years. But yeah, are there any particular reasons why?
I suppose speaking from my own kind of experience and understanding like our local knowledge, etc., is that, as I've kind of alluded to, is like the ongoing challenges in engaging people much earlier on and early enough in treatment or harm reduction to be able to engage them, to look at their use, look at their general health, look at their mental health, so that we can minimize the potential impacts of non-fatal or fatal overdoses. You know, as we know, all overdoses can be prevented, but depending on you as an individual and how you use and the times, the days that you use, if you're isolated and you live alone, that the risk is heightened dramatically. But making people aware of that and making people aware of the nation's affiliation with polydrug use and now using other substances alongside, you know, your, for want of a better word, your primary drug of choice. I think that's huge. And I think particularly then with the aging cohort of people who use opiates as well, or opioids, particularly like with heroin, who are facing that cumulative like health risks now because as they're getting on, and what they need to be aware of and need to be managing and having that open dialogue with health professionals that we can assist them in preventing potentially something like a drug-related death happening or occurring with them. So I think, you know, the instability of the marketplace has played a huge factor in opioids, and the availability or the lack of availability as well, rising cost of everything, apart from drugs, but that obviously has an impact in quality and quantity of substances as well. So there's so many things to address there. I think that's, from what I've just mentioned, is just scratching the surface. But I think one of the major factors we need to look at is from us as a drug and alcohol service, how do we promote and engage all individuals but being mindful of as well the capacity and the ability to be able to, if we go out looking for those individuals, I have no doubt they'll come into services, but then what kind of service will they get? What quality of services? What frequency of the service will they get and provide, which would be of benefit to the individuals that need that kind of treatment and support for their ongoing recovery, or to continue using within the realms of like harm reduction.
Does that allude to then that essentially like services are just incredibly busy, which impacts then the quality that people who
100%, there's so many factors we can play in there. We over the years we've lost a skilled labour workforce who have had X amount of years of experience working in this field, who have maybe gone on to other roles, other areas of work. We've had an intake then of new staff with potentially different expectations of the role, pre and post pandemic as well. We've had a significant increase in referrals of other substances, alcohol namely being one of them, which obviously has then issues around capacity and success rates. Are we getting people in and then out to the other end? Or are we having people coming into services and staying in services because the potential of the inability to move on in their recovery? So we're always constantly dealing with crisis, damage limitation, and I know within harm reduction that pretty much comes with the course, part of the course of the service that we provide. But the capacity issue can be quite debilitating then of when it creates bottlenecks. And then also if you're trying to get those individuals into treatment, so, more of a clinical involvement and what their capacity is and how people are able to move through the network of treatment and support systems. Do we make it easy for people to get into services? Not always. What happens for people who may do really well, but then need to come back in? The consideration, and then those individuals that may have gone into treatment, prescribing services, tier 4 provisions, and then a step down and then brought back into, should we say, our services like tier 2 education, support, recovery work. Once again, then you're sandwiched in the middle of where do these people go? So, we've seen the use of peers to support one another, creating recovery networks, users unions to support one another. So using the natural resources that are there, concerned others, families, friends of individuals, to help them support those individuals. There's so much to explore, and there's so much there's so many pressure points there as well, which is a challenge.
The more I kind of think about it, the more complex it just becomes, and you just go down a complete and utter rabbit hole. Like you mentioned in terms of, are we doing as well as we can in terms of engaging people, and I always think to a degree our hands are tied legislatively, if that's a word. If you look at cocaine, for example, obviously the cocaine related deaths, you can't disaggregate between powder cocaine and crack cocaine, so you don't know how many is from one and how many is from the other. But obviously we've talked about it before in terms of safer inhalation devices, crack pipes, and the evidence is there in terms of just purely from an engagement point of view. But then, if you engage those new people, then obviously you kind of go back to what you said earlier in terms of, that quality of provision that is provided to those individuals and there as well. In terms of moving forward then, James, obviously I think it's worth noting in terms of, you mentioned alcohol. Alcohol is it's the number one drug, that most treatment services kind of are faced with when people are accessing support around their substance use. And actually alcohol related deaths in Wales and across the UK are at highest levels as well. I think in Wales, in the last data for alcohol specific deaths was in 2023, and that came out as 562. So actually alcohol-related deaths in Wales is higher than all illegal drug deaths put together. And obviously, when we were talking about drug-related deaths at the top, they are also split into drug poisoning and drug misuse. So drug poisoning includes suicides. And I know kind of like we discussed before this recording about, which one should we report on? Should we report on drug poisoning or should we?
They're different strategies as well.
Yeah.
Yeah. And I think that's part of when some of the policy and public health implications, I think, is the need to improve data linkages. And obviously it's explicit, you know what, but it's like, how does the media interpret drug poisonings and substance misuse deaths, and looking at the two, how you map that, how do you take into consideration areas of deprivation, and also identifying that some areas have larger populations and metropolis cities, so there's a focus and a concentration of different types of substances across Wales, which then always has alcohol in the background then, isn't it? And also considering like polydrug use when there's multiple substances involved, and how a lot of people who come into services these days, they're reporting that they use multiple substances, not just historically as it has been for some people, just the one substance. And that's got a lot to do with all the marketplace dynamics and cost, availability, all those kind of things as well. So it's quite interesting.
Basic economics.
100%.
Absolutely. So ways forward, James. Being the self-proclaimed greatest drugs worker in the world.
God's favourite drugs
God's
worker.
favourite, was it? Okay. I'm putting you to your test now.
Yeah, okay.
How do we stop this? How do we halt this? Because for me, I think we have to look internally in terms of within the substance use field.
And organisations, 100%.
And when I talk about internally, I mean in terms of like policy and legislation as well, straight all the way down. I think we need to look at that. But also, I do feel as if maybe we have to look at the structural drivers of drug-related fatalities, in terms of like poverty, deprivation, mental health, welfare benefits. We have to look at kind of, those kind of like fields and their related policies and legislation that obviously aren't formally about drugs as well, because they're all interlinked. And I think if you were able to significantly improve one, whatever that looks like and however you do it, it would have a knock-on effect on a variety of things. But from your perspective, James, how do we halt this, and how do we go the other way in terms of the number of fatalities?
So I think from a public health perspective, and with regards to the implications, I think there's an urgent need to look at expanding harm reduction and messaging, and who that goes out to, and how we amplify the messaging, and what platforms do we use to get our message across and make people have a better understanding of harm reduction and what its goals are. Strengthen treatment, retention and re-engagement. I think, if you went in on the detail of the data and looked at the deaths as individuals, as people, and seen and explored what their experiences of support and what treatment looked like for them, would be a real interesting review to see, how many times has that person actually come in and asked for support? Did they get the right support at the right time? How many times did they, drop out the treatment and support, for good or for bad? Some people have moved away from support services because they were doing really well, and you've got to respect that. But then when times get difficult, and the ability to come back into support services and treatment services without the stigma of feeling like you've let people or individuals down, not just services, but like family members, people close to you. And also integrate the physical and the mental health elements of care, so that they're more closely entwined with like substance use services. There are some areas which have some great examples of where that happens. But I think there's no consistency across Wales in particular. I envy some of the areas in Wales that have some absolutely amazing services and individuals working in those services as well, which is sometimes led to the availability of funds which have been pumped into those areas, and also personalities behind the driving factors of being innovative, progressive, and engaged with services, and also bringing policy and the grassroots of substance use. And one of the main things I would like to stress is that we're talking about all drugs, not just opioids, not just cocaine. We're talking about all substances, because the people we see a tiny proportion of individuals that use substances, and I think if we can get the message out to everyone, whichever way we can, and have that full spectrum harm reduction approach, that for us would be a starter for 10, and to see if we can have any inroads or impact on the numbers of people who are sadly passing away.
Absolutely. Jamie, I think we'll leave it there. Just to finish on, really, obviously 417 people passed away from drug poisoning according to the ONS figures in 2024, and it's important to remember that each and every one of those is a person, is a human being, and they have also kind of left loved ones behind as well. So on that note, Jamie, thank you very much, and to everyone else, we will see you soon. Bye-bye. If you have been affected by any of the issues discussed in today's podcast, please reach out. Barod have a free and confidential live web chat service that is available 7 days a week on our website at barod.cymru, where you can chat to a trained support worker. Alternatively, you can contact Wales's National Drug and Alcohol Helpline, Dan 24/7, either by calling 0808 808 2234 or text Dan to 81066.